With the news that health insurance provider Aetna would be bowing out of the public exchanges of the Affordable Care Act because they're throwing a tantrum since the Department of Justice won't allow them to monopolize the market and approve their merger with Humana, we're seeing how obviously flawed Obamacare really is. So this, of course, led to renewed calls for a public option, and the individual leading the charge, unsurprisingly, is Bernie Sanders. He states, in my view, the provision of healthcare cannot continue to be dependent upon the whims and market projections of large private insurance companies whose only goal is to make as much profit as possible. That is why we need to join every other major country on earth and guarantee healthcare to all as a right, not a privilege. These companies are more concerned with making huge profits than ensuring access to healthcare for all Americans. Now, the ultimate goal, of course, is to have a single-payer healthcare system set up in America where we all just have healthcare based on our taxes. We fund it through our tax dollars, and the insurance companies are completely out of the equation. They're abolished, they're not needed, because we don't look at healthcare as a profitable industry. We look at it as a right. Everyone has it. We all pay into it. We all fund it with our tax dollars, and there's nobody that can be excluded. That's the goal. But with that being said, a public option would be a huge step in the right direction because private insurance companies would be forced to be less tyrannical since they'd have to compete with a government-run option. So with a public option, you can choose either to buy insurance from a private company or you can go with the governmental form of insurance, hence why it's called a public option. So Vox explains why this is really important. A public insurance plan for working age people could compete with private insurers and use its bargaining power to push back against drug makers, medical device manufacturers, hospital systems, and other healthcare providers. A public plan would hold down costs more through insisting on lower prices than through micro-regulations of patients or extremely restrictive networks of providers. So at the end of the day, a single payer system is just common sense. But if you're not even going to have that, then it's essential that we have a public option. It's not just pragmatic, but it's the ethical thing to do. If you're going to allow these unethical insurance companies to exist, then at least make them compete with a government-run plan so that way they can't get too tyrannical. Now the question is, how are Democrats responding to this renewed effort to get a public option? Well, you're not going to be surprised to know that Senator Sanders' renewed push for a government-run healthcare plan is getting a tepid reception from Democrats, with some saying he is waging a losing battle. On Capitol Hill, Democrats think a fight over a public option is nearly impossible to win, regardless of how the November election shakes out. The public option was a good idea in 2009, and it's still a good idea today, but I don't know that the politics have changed at all on it, said Senator Chris Murphy. So in typical spineless Democrat fashion, they're going to back down from a fight before it even begins, and this is in spite of the fact that 77% of Democratic voters, Chris Murphy's base, supports a public option. So he doesn't even want to try to fight in spite of the fact that they might take back Congress and their own party wants them to do this. So, quote, Democrats also appear wary of another politically taxing battle over healthcare. Out of the 11 Democrats running for open or contested seats this year, only Senator Chris Van Hollen is pushing the public option during campaign appearances. This is absolutely pathetic. It's not even like they're trying and then failing. They don't even want to try. They're not even showing up to the fight. And these idiots have the audacity to say, how dare you vote for Jill Stein? How dare you go third party? This is why. And the vote share that the Green Party gets is going to continue to get larger and larger each election cycle unless these idiots wake up. Now, is it the case that Chris Murphy is spineless? Absolutely. He doesn't want to fight. He doesn't want to be principled and actually fight for the people who put him in office. But you have to follow the money if you really want to know why these spineless corporatist Democrats don't fight for us. Senator Chris Murphy, who claims the battle would just be too difficult, has taken $342,000 from healthcare professionals and $395,000 from insurance industries, various insurance industries. So if you're ever curious as to why these Democrats, they don't want to fight for the policies that their own base wants, this is why. It's because they're taking money. They're bought and paid for by the health insurance industry. Why is it that Hillary Clinton proposed one of the best healthcare plans ever in the 90s, Hillary Care, and then all of a sudden she started to back away from that? She proposed a full-on single-payer healthcare system, and then the health insurance industry bought her off. Now, she did pass the child health insurance program, CHIP, but all of a sudden she's not in favor of a single-payer healthcare system anymore. She says she's in favor of the public option, but we know that's not true because guess what? She's taking money from these health insurance industries too. So you can be bought easily in Congress. It doesn't even take millions of dollars. It takes less than $1 million, and you can completely buy off a politician. It's pathetic.
Health emergencies can't wait for us to have some theoretical debate about some better idea that will never, ever come to pass.